The lingual nerve, as I just told you, coming from the branch of V3, will give sensory innervation to the anterior two-thirds of the tongue. Taste from the tongue will be given from facial nerve, a specialized portion of it called the chorda tympani. For the posterior third of the tongue, both taste and common sensation are given by the glossopharyngeal nerve, cranial nerve number 9. Then the muscles of the tongue itself are innervated by cranial nerve number 12 in order to give motion, protraction, retraction, and depression. As we go back and we look at ovale again, and I tell you about the V3, the branches I just told you about are all responsible for sensory innervation. However, V3 also has motor branches which give off to several different muscles. The V3 motor branches will go to the masseter muscle, which originates here at the lateral aspect of the angle of the mandible and goes up to the inferior border of the zygomatic arch. Another muscle of mastication that V3 innervates is the temporalis muscle, which attaches to the coronoid process, runs up underneath the zygomatic arch, and ends up attaching to the faint temporal lines of the parietal bone in a fan shape as I'm swinging the probe. That's how the fibers run, up and down, and it kind of fans out. V3 is also responsible for innervating the lateral pterygoid muscle, which runs this way, I guess like this, and originates at the lateral aspect of the lateral pterygoid plate and enters into the pterygoid fossa just underneath the condyle of the mandible, right there. And then also V3 innervates the medial pterygoid muscle, which goes from the medial aspect of the lateral pterygoid plate, runs inferiorly, and inserts into the medial aspect of the angle of the mandible. V3 motor innervation will also go to the anterior belly of digastric, which will attach here to the digastric fossa. And also V3 will innervate the mylohyoid muscle, which attaches in part to the mylohyoid line on the mandible. So that concludes V3 and the trigeminal nerve in total. Now let's continue to go backwards so we get into the posterior cranial fossa, and we have the internal auditory meatus. The internal auditory meatus has cranial nerves number 7 and 8 go through it. Number 7 being facial, number 8 being the auditory nerve. The auditory nerve will end up going to the inner ear to provide sense of balance and hearing. And the facial nerve, cranial nerve number 7, will go in the internal auditory meatus and will exit the stylomastoid foramen, which, as you know, is conveniently located between the mastoid process and the styloid process. So you have the stylomastoid foramen. That's where facial will exit and give off its innervation. Next, cranial nerve 9, 10, and 11 will all exit through the jugular foramen. Cranial nerve number 9 is glossopharyngeal. Cranial nerve number 10 is vagus. Cranial nerve number 11 is spinal accessory. Cranial nerve number 9, as I mentioned to you before, is responsible for giving common sensation and the sense of taste to the posterior third of the tongue. The vagus nerve, cranial nerve number 10, will exit out the jugular foramen here and travel downwards, and it will end up being the sandwich meat in a sandwich involving the internal jugular vein laterally and the carotid artery medially. It will travel in a carotid sheath there and will end up giving off lots of branches which are responsible for different innervations. First, the vagus will give off motor innervation to the muscles of the constrictors. The vagus nerve will then give off the superior laryngeal nerve. The superior laryngeal nerve will then branch into the external and internal laryngeal nerves. The external giving motor innervation to the cricothyroid muscle, the internal giving sensory innervation to the area above the vocal cords. As vagus continues down, at the area of the aortic arch on the left-hand side and the brachiocephalic trunk on the right-hand side, the vagus will give off the recurrent laryngeal nerves, which are responsible for coming up and giving sensory to the area below the vocal cords and giving motor innervation to the muscles of the vocal cords themselves. Then, as vagus continues to go down after giving off recurrent laryngeal, it's giving exclusively parasympathetic innervation. This parasympathetic innervation will end up innervating the trachea, the bronchi, and the heart in order to allow for your rest and digest phenotype, which comes or accompanies the parasympathetic innervation. And then at the level of T10, vagus will pierce the diaphragm with the esophagus, the left vagus being on the anterior surface of the esophagus, the right vagus being on the posterior surface of the esophagus. Last cranial nerve that we have to go through is the hypoglossal nerve, which conveniently goes through the hypoglossal canal. The hypoglossal nerve is responsible for giving motor innervation to all the intrinsic and extrinsic muscles of the tongue. The intrinsic muscles of the tongue simply refer to the muscles that make up the bulk of the tongue. The extrinsic muscles of the tongue are the genioglossus, the hyoglossus, and the styloglossus muscles.